Childhood cancer is at the forefront of the St. Jude mission, but believe it or not, that's actually not all they do.
In fact, St. Jude has one of the largest sickle cell treatment programs in the country. In this morning's top story, I sat down with Dr. Jennifer Light at the Peoria St. Jude Affiliate Clinic to learn more. Peoria is home of the first St. Jude Affiliate Clinic, bringing expert care to patients with cancer and blood disorders, including sickle cell disease.
Sickle cell is a genetic disease passed on by mom and dad, and it affects the red blood cells, and it makes them into this C shape, which gets caught in the blood cells and causes a whole lot of trouble.
The most common types of the disease are hemoglobin SS, S-beta 0, and SC, but some are more severe than others. What is the mortality rate of someone with sickle cell disease?
In children, the 98% will reach adulthood. Now, the life expectancy for sickle cell disease is still only in the 50s, low 60s. And so the lifespan is still very much decreased.
Though the blood disorder can occur in all races, it's most prevalent in the African American community. According to St. Jude, about 1 in 365 black babies in the country have sickle cell disease, but possessing the trait is more common.
1 out of 5 African Americans can have trait, which is not a disease, but it does have some things that you tend to need to look out for and that you also need to know of as far as family planning as well.
What are some major symptoms?
The major symptom is pain, and it can be the most severe pain that anybody has ever felt.
St. Jude scientists have studied the blood disorder since the hospital opened in 1962.
Over the last few years, there's been a few breakthroughs, and it's only been since 2017 that we've had the breakthroughs, and we've had 3 more drugs approved for sickle cell disease since that time.
In addition to drugs, gene therapy is another healing method. However, Dr. Light says more research needs to be done.
The research into sickle cell is fairly new when you talk about overall research. I mean, it was only discovered in 1901.
Collaborative efforts with institutions around the world, scientists and doctors with St. Jude are learning more about the disease every day with the hopes that it leads to new and better treatments.
There's a lot of things going on at St. Jude, and one of the studies that we are a part of, which is called SCRIP, and it is looking at a lot of different things as far as natural history of how things go in different complications and what makes a difference in outcomes.
Office mates. A great conversation with Dr. Light. In addition to cancer and blood disorders, St. Jude Children's Research Hospital treats neurological disorders, infectious diseases, and other related life-threatening illnesses.